Many people with type 2 diabetes are content as long as their blood sugar levels are not in the danger zone. But what they don't know is that there's a more sinister problem that is developing deep within, something which is very silent, something which they don't know about. Hi, my name is Dr. Etuket, and welcome to the Between the Sets Exercise Podcast. In this episode, we'll be discussing the damage that type 2 diabetes has on your kidneys. So as usual, I'll be doing a couple of exercises, and in between the sets when I'm resting, Timothy, one of my teammates, will be asking me a couple of questions and guiding us through that discussion. So Timothy, you can just let me know about the first question while I warm up.
All right. Okay, let's see. So, maybe we would start from the beginning.
All right.
What exactly do kidneys do in the body?
Kidneys. Kidneys are very important organs in your body. They have a variety of functions. Let's look at the most important. The first important thing which kidneys do is that they act as a filter. So they are helping get rid of toxins which are in your body. So the most important things like urea, creatinine, but also drugs which you take, they are breakdown products which come from those. Your kidneys are important, and they are the most important organ. Well, I could argue maybe only the liver comes close in helping get rid of those toxins from your body. You want to make sure that your blood is fine and doesn't have any toxins, any poisons or things like that which could actually cause harm to the tissues. So that's one thing which kidneys do. The other thing which kidneys do is that they regulate fluid balance. So by regulating the amount of fluid which is present in your blood, it is going to help to regulate your blood pressure. So that's why when your kidneys begin getting issues, your blood pressure can also start to rise. Kidneys also produce actually hormones. They produce, I guess, two very important ones. One is erythropoietin. This is a hormone which stimulates your bone marrow to produce red blood cells. Red blood cells have a pigment called hemoglobin, HB, for some of you who have done a CBC here and there, maybe when you're sick or something like that. Yeah, so that hemoglobin is that pigment which helps the red blood cells to carry oxygen. Oxygen is required to be taken to the tissues, and that's what's going to give your cells energy to function, to do the various functions which they do. So in the setting where, say, your kidneys are damaged and you're not producing enough erythropoietin, your red blood cell count will drop, and then you can be at risk of anemia. I guess we shall talk about that later on. Your kidneys also produce a hormone called renin, which is necessary for regulation of blood pressure. Your kidneys also help to activate vitamin D, and vitamin D is needed for absorption of calcium, which is required for bone strength, bone health. Your kidneys also regulate electrolytes: sodium, potassium, phosphates, magnesium, and several other electrolytes. So that's very important for making sure that your body functions well. If your electrolytes are not in the right range, you can begin getting issues to do with your heart and several other organs. Another thing which your kidneys do is that your kidneys also help to regulate acid-base balance. So they help to regulate what we call the pH of your blood. If you remember some science, if you didn't hate chemistry too much, you remember on the pH scale, there is the acidic side, which is from 0 to about 7, if I remember well, and then to about 14, that's now the basic side, the base side. So your kidneys help to regulate that acid-base balance. And again, if you have issues happening, if the acidity levels of your blood of your body are not controlled well, you can also get issues. I guess we shall talk about those later. Anything else, Timothy? So I'm just warming up with push-ups for dips with push-ups. Maybe before Timothy asks the question, since it's an exercise podcast, I'm getting to another cycle of training. I don't like changing up exercises too much. So for those of you who may have watched episode 1 and episode 2, you may have noticed I was still doing dips and pull-ups. I'm not going to change them. You don't change too much. Again, if your goal for exercise is just to be active and leisure, get your adrenaline running, sweat, then you can change up exercises too much. But if your goal is building muscle, and muscle being very, very important for metabolic health, control of your blood sugar, making sure that you lose fat consistently. You don't want to be changing up exercises too much. You want to kind of like squeeze the last bit out of each exercise before you change it. Yeah. Okay, Timothy, ask the next question. So I've warmed up the back, doing a couple of squat pull-ups. I've also warmed up the chest a little bit with the push-ups. So right now what I'll be doing is pull-ups. All right, Timothy, ask me the next question.
All right, so how does type 2 diabetes affect kidney function?
Type 2 diabetes and kidney function. So there's this thing called chronic kidney disease. Chronic kidney disease, it's so chronic, long, happens over time. So you can have acute causes of kidney damage. Like if you take certain drugs, they can cause acute kidney damage. If somebody shot you, God forbid, or you cut yourself and you bled out massively, you can actually damage the kidneys. But many of those, if you correct those things, they can be reversed. They can be reversed and your kidney function resolves, like your kidneys become okay again. But with chronic kidney disease, damage happens over time. And the unfortunate bit about chronic kidney disease is that it's really silent. Like it doesn't normally just shout out there and say, and you know that there's actually a problem. It's a silent killer. So there are two most common causes of chronic kidney disease: type 2 diabetes and high blood pressure. Actually, between them, and type 2 diabetes is actually the worst. Yeah, but between them, they actually account for about 60 to 70, 75% of the cases of chronic kidney disease. So that's why it's very important for you to keep your blood sugar and blood pressure under control. Let me first get those reps in for the pull-ups. I'll actually be doing chin-ups again. In my last cycle of training, I went, because like the goal is to increase the volume of training. So either the number of reps, number of sets, or both over, say, a 4 to 6 week period. So I think by the end of my 6 weeks, I had gotten to about 12 chin-ups. So I'm going to try and start this cycle at around 10 chin-ups and then try to increase those reps gradually over the course of this period, such that maybe by the end, I'm maybe hitting about 15 repetitions for the pull-ups. So I'm going to start with 10 reps. So that over the course of about 5 weeks, if I increase maybe 1 rep a week, I actually get to about 15 reps of pull-ups. So let's see how that goes. Again, keep the chest out, pull. Two more. That's it. Then I'll go to 2 dips. Again with dips, I'm going for dips. I think I'll go for, anyway, it's the start of the cycle. So let's start with 10. I know by the end of the cycle, I'll be doing more than I was doing the last cycle, and that's all it matters. You're just progressing cycle and cycle. So don't put yourself in too much pressure to get maximum gains, say in 5 weeks, 6 weeks, in 2 months. No, know that you're committing to this for a long time, like literally for the rest of your life. Yeah, but for a long time, bare minimum a year. And if you can be consistent in that kind of progression, by the end of the year, like you'd be shocked at what your body is capable of doing and what it looks like and what your health parameters look like also. Okay, go for 10. One more. Okay, break. Timothy, next question.
Okay, so we have, it seems you've brought up the issue of hypertension. I didn't know that even high blood pressure is related to kidney disease. So what role does hypertension or high blood pressure then play? in kidney damage?
Yeah, so maybe something which I may have missed. So your kidney, going to make it like kidney, I remember at medical school, it's one of those organs which is like, yeah, it was one of the harder organs to read, at least for me. Of course, the nervous system was alone, like respect to the nervous system, the brain and all. Yeah, so if you see a neurologist, respect them. Yeah, but anyway, if I'm to make it as simple as possible, just think of your kidney. Your kidney has several parts, but it has a functional part of it, what we call the glomerulus. Now think of that as a sieve. Think of it as, like, yeah, just think of it as a sieve, as a filter. Now, that glomerulus has blood vessels. Now, if those blood vessels get damaged, proteins can begin leaking into the urine. And the most important cause of damage to that membrane, to those blood vessels in the glomerulus is high blood sugar. However, so that glomerulus is like, it's like cup-shaped like this, and then you have arteries here, but rather smaller arteries like arterioles, what we call arterioles. But there's an artery bringing blood, and then it gets it, and then the blood goes through that smaller network of blood vessels, and then the blood leaves. And as blood gets into that smaller network of blood vessels inside here in this cup, certain things diffuse from the blood vessels here into this other cup portion, which actually leads to the kidney tubules, so those things drain out and then they end up getting making up urine. So the blood brings several components. It passes through this small network of blood vessels. Some things leak through, diffuse through, and then gain access to the kidney tubules. And then those kidney tubules end up like taking away like those components and forming urine, and the urine, of course, you go and pee it out when you go to the bathroom. Now, type 2 diabetes is going to, high blood sugar is going to damage that network of arteries. However, if you have high blood pressure, that pressure is going to be experienced, the artery bringing the blood to that small network of capillaries, of blood vessels, which is here. That blood pressure is going to affect those blood vessels, that network of small blood vessels here. And it's going to actually damage those arteries. But another thing which happens is, when the pressure which is coming in is high, it's going to cause these blood vessels to constrict. And that is actually what causes, so it's going to reduce on the blood supply to this network of arteries, and then that network of arteries is going to scar. It's going to scar and get damaged. So you have type 2 diabetes directly affecting the membranes of those arteries here, and then you have the high blood pressure also now contributing to scarring of the membrane. And that is why high blood pressure and type 2 diabetes are the two most important causes of chronic kidney disease. However, damaged kidneys also raise high blood pressure. So this is the weird thing. You may start out with type 2 diabetes. High blood sugar is going to damage that network of arteries. But then the damaged kidney itself is also going to result in high blood pressure. Now you could have high blood pressure coming in from something else. And for those of you who have followed us long enough, you know that the major issue when it comes to metabolic disease starts with the wrong nutrition. The wrong nutrition causes your insulin levels to spike. Insulin makes you store fat. First you store it under the skin, then you start storing it around the intestines. When you store it around the intestines, it's called visceral fat. Visceral fat causes inflammation and insulin resistance, where your cells don't respond well to insulin. And then insulin resistance causes high blood sugar, high blood pressure, and a couple of other things. Now, you could have high blood pressure being caused by that mechanism. But then, as the high blood pressure or the diabetes, or both of them, damage the kidneys, the damaged kidneys also further worsen the high blood pressure. So it's a vicious cycle kind of thing. So your high blood pressure could have been caused by your poor poor lifestyle habits, but then even the damaged kidneys are also further worsening the high blood pressure. So it's a really sinister cycle, which I don't think you want to get involved in. Yeah, Timothy.
That's so wild. That is so wild. So kidneys, no wonder kidneys are so expensive.
Yeah, kidneys are basically priceless, and I guess that's something which we shall talk on, which we shall talk about later on the podcast. All right, let me go for my second set while Timothy prepares that other question. Once you get it, you can just ask it. Okay, so going for 12 reps, as Timothy gets that question. 2.
All right.
You can ask it once you have it.
All right, so does kidney damage happen suddenly, or is it something that develops slowly over years?
Okay, 6 reps, 6 to go. That's 10, 2 to go. Whew. So kidney damage. Yeah, so in the context of high blood pressure and high blood sugar, yes, it happens gradually, not suddenly. However, we said there are other causes of kidney damage which can happen suddenly, but that's out of the scope of this discussion. Yeah. Another question?
Okay.
12 reps. Well, Timothy gets that question. 2, 1, let's go. That's 4. 6. And 12.
So, seeing as kidney damage is something that can probably happen over years.
Yeah.
So why is it called a silent condition? Why is kidney disease often called a silent condition? Does that mean it's silent? It comes up on you without knowing?
Yeah, because I could just narrate two stories. So someone who I talked to a couple of years back, person expressed interest in working with us in our program. Yeah, and he came on, and he was overweight, yes, but his blood sugar levels were normal. His blood pressure, to be honest, because I see this a couple of times, he could have gone to a health facility and he could have passed as, at worst, borderline. It was just the weight. But something which I do before we work with anyone is I want to get a couple of tests, because being a doctor, safety is very important. We need to ascertain risk. We need to know exactly everything which we're dealing with before we get started, so that we can also set goals, appropriate goals, smart goals, specific, measurable, attainable, realistic, time-bound. Yeah, and so there's good understanding on both of our parts. I like giving bold promises. This we can definitely help you do if you follow. This, not so sure. This we can't help you with, and if I can, I point you in the right direction. So I sent him for kidney tests, kidney function tests, which we shall talk about. And his kidney function was reduced. It was about 40. To give you context, you want it to be, you don't want it to drop below 90, and definitely you don't want it to drop below 60. So 60 to 90 would be like a warning zone. Oh, hold on, there are issues here. Yeah, but it was at 40. But remember, he was just overweight. Sugar levels were normal. His pressure was slightly elevated. Yeah, so it's silent like that. This gentleman just came in, and he's just one of many. He's just one of many. I can tell you of people whose kidney functions, this lady who came in and her kidney function was about 7. Now, to give you context, 0 is the worst. She was basically in stage 5. And normally, at that level of chronic kidney disease, that's what requires kidney transplant, ideally, which, as we all know, is, I don't think it's readily available in Uganda, at least to the last I checked. Yeah, it's something which you most likely need to fly out to maybe India for. Yeah, so, but again, even him, his sugar, he had diabetes. She had diabetes rather, but it was controlled. It was in normal range on medication. The blood pressure was a little bit slightly borderline. You get it? Again, was on drugs, but things were controlled. Controlled, if I would say. Yeah, but the kidney function was at that point. And at that point, I'm going to be honest with someone and say, you know what? This is what is at hand. I can help you lower the blood sugar. We can help you lower the blood pressure. We can help you reduce the medication, which actually would be of benefit. Certain medications would be of benefit to remove some of them at that level of kidney damage. Yeah, but I can't help you reverse the kidney damage. It's a little bit too late. Something which is very hard to tell people. Yeah, but we need to be honest with them. And like for this lady, she decided to, between her relatives and what, they began a fundraising for a kidney transplant, which I think goes anything, like I think in India goes anything between 70K US dollars to 100K US dollars. And I don't think that involves travel and accommodation. Does it, Timothy?
No, not really. Ideally, it's about $80,000. Then you probably need maybe between 5 and 10,000 extra for accommodation and upkeep.
Yeah. So that was the thing. Again, even her, she didn't know that her kidneys were that hit. It was just because we carried out the tests. So no pain. Like it normally presents with no pain, but there are some early warning signs which may present in some people, which I guess we shall discuss after the next set. Yeah, so right now in the sets, I'm beginning to feel the pump. Yeah, but that's something which you want to feel. You want to feel that you are, you don't want to feel comfortable with your training. So like for the dips in the last set, I said actually we were going for 12. I realized, hold on, we went for 10 in the first set. But I said, what the heck, let's just push it to 12. Yeah, so I kind of pushed through them. You want to kind of feel that, you want to feel like you're pushing through a little bit. Not again too much, but you're pushing a little bit. If you just finish the set and you feel like you could have done 5 more reps, no, that was not an effective set. An effective set is one which challenges you. All right. Oh, hold on. I think it was the pull-ups which were 10. No worries. We shall push for 12. Let's see. 2, 1, let's go. That's 3. That's 7. 4 to go. One more. Woo! That's crazy. So with those 12 repetitions, they're quite challenging. I would see how I feel at the end of the week or at the start of next week. And if I still hit the 12 and they're a little bit more challenging, I could still keep the number 12. But what I could intentionally begin doing is squeeze more as I'm moving through, focus on trying to get higher with the pull-ups, control my descent, quick up as I come down, control it more. Yeah, still to fatigue the muscle a little bit more. So sometimes you don't need to be increasing on the number of repetitions. Sometimes it's actually many times it's more important to increase on the quality of each of the repetitions which you do. Yeah. Okay, let's go for 12. 2, 1. That's 3. 6. That's 10. Whew. Next question, Timothy.
So, you hinted on something in the last question you answered that I've been actually also thinking about. So we keep hearing there is stages in kidney failure, kidney damage.
Yeah.
Stage 1, stage 2, stage 3, stage 4, then stage 5. So what are these stages, and what does each stage mean in regards to how far the disease has progressed, or
Yeah.
the possibility of treatment?
Okay. Maybe if you'd allow me, I can start first with what are those early signs and also symptoms, and then go into like the tests which can be done, and then we could also talk about what are those stages of a kidney damage. So when it comes to the early signs, so remember, if the kidneys are not functioning well, they won't be filtering the toxins, most especially urea and creatinine. Now, if those toxins accumulate in the blood, they can affect different organs. Remember, the blood goes to all the organs of your body. So if we start up, so that I try not to forget any body part. If we start up, what's going to happen in your brain, those toxins can actually cause altered mental state. So there could be confusion, increased levels of forgetfulness, fatigue generally. If you look at your skin, some people can have dry skin. There can be itching of the skin because things like urea can actually enter the skin and begin causing those kinds of irritations. Actually, which makes me think about a certain client of mine who has been having lots of eruptions, itching of the skin. And just recently we discovered that his kidney function was actually dropped. Yeah, so again, and this person had gone actually to a couple of other doctors, and they even did allergy tests for his skin, but everything came back normal. So he was just put on drugs to help manage the allergic reactions. There's a high chance actually that this is it, because actually when we did his kidney function, it was quite reduced. So at 30, again, we shall talk about that. So that's important. Anyway, I was just writing that because it actually crossed my mind. And when I spoke with him last, to be honest, it's something which had kind of crossed my mind, but that's something which I'm going to have to bring up with him. Yeah, so that's in the skin. The kidneys also regulate, remember, acid-base balance. So if the pH of the blood is not being controlled well, you can be getting breathing problems. The kidneys also regulate fluid balance. So things like headaches can begin showing up, like the symptoms of high blood pressure. Headaches, dizziness, swelling of the legs, and it normally starts at the feet. And normally if you press around here, like just behind this bone, we call it the malleolus. If you just press behind here, and if you press, normally if there's no fluid which is accumulating, if you press, hold down with your thumb and then release, there should not be like a ditch or like a depression forming. But if you press and a depression forms, obviously I don't have swelling of my limbs, what we'd call edema. Yeah, so in my case, you don't see any pit forming. But in this case, in somebody who had, say, grade 1 edema, which is basically stopping at the ankles, you would see that pit forming. You can even also demonstrate it if it's grade 2, where it's rising to, it's also affecting the leg. If you pressed to the medial surface of this bone here, of the shin bone, there would also be a pit forming. As I said, in my case, I do not have edema. But you can have swelling of the limbs. Now, because most people sleep when they're lying down, yeah, there can also be puffiness of the eyes. So if someone wakes up in the morning and their eyes are puffy, again, because as they lie down, like the eyelids are really, yeah, like their skin it can be distended easily, so fluid can accumulate there, and somebody wakes up and their face is puffy, especially at the eyelids. So that's the kidneys. We talked about anemia, because the kidneys produce erythropoietin, which stimulates the bone marrow to produce red blood cells. So if your red blood cells are reduced in number, that means there's less oxygen being carried around in your body. Oxygen is required for production of energy. So you'll find yourself feeling fatigued. So the fatigue in the context of chronic kidney disease is mostly associated with that level of anemia. Of course, if you're not absorbing, remember the kidneys help to activate vitamin D. So if you're not having, and vitamin D is required for calcium absorption. So of course you may also begin getting certain bone pains and bone issues in the setting of chronic kidney disease. Yeah, so those are some of the things. I probably maybe I've left out some, but yeah, those are some of the signs and symptoms which can come about. Now, when it comes to tests, the most sensitive test, if you want to capture kidney damage as early as possible, you want to do what we call a urine albumin to creatinine ratio. So albumin is a protein which is produced in the body. So, and it can be present in the urine. It shouldn't leak into the urine, but once it starts leaking into the urine, like it's the earliest sign that that filter barrier is being breached. Remember, we said diabetes damages that, but also high blood pressure can up the pressure, which is coming to that functioning unit of the kidney, and then begin causing scarring of the blood vessels, the ones which I said, which are in that cup shape of that structure. Yeah. So if you have a urine albumin to creatinine. Creatinine is a waste product produced by the kidneys. If you have the ratio of albumin to creatinine being less than 30 milligrams per gram, that's a sign that kidney damage is happening, and it's something which you want to correct as quick as possible. Next, you can also check what we call the EGFR. EGFR, estimated glomerular. Remember, we said that the function unit of the kidney is the glomerulus. So EGFR, estimated glomerular filtration rate. So EGFR. Yeah, and that's the one which you want to be above 90. So it's one which is a little bit more common, because as long as you have the levels of your creatinine, so you just do the levels of creatinine in your blood. And then there's a fancy equation which we can put that value into, and then we calculate your EGFR. So you want it to be above 90. But once it begins dropping below 90, but between 60 and 90, that's what we call stage 1 chronic kidney disease. And then it keeps on, you like keep on going grading of the kidney disease until you get to stage 1, stage 5. Now, stage 1, stage 5 are the ones, normally those ones are not reversible. I'm currently working with a client whose EGFR started out at about 40, and we've been able to bring it to about 48 now. Yeah, and God willing, we'll be able to bring it a little bit higher. I think that will be an amazing testimonial for this person. We haven't yet done it for anyone who is below there. Normally, if you come in and your kidney function is about 60, 70, I tell you, you've come in good time. If you follow what we're going to guide you on doing, you'll be able to lower the blood sugar, lower the blood pressure, and then the kidney function will also improve. But when you get it low like that, you need to go into things like dialysis, kidney transplant, and I guess we can talk about those, but I want to hit the next set first. All right, so we are going to do, let's do rows. So it's the first week of training, so I'm just targeting 5 sets. 5 sets, and first week of training, it's kind of just, I'm coming out of the deload, I've been resting. I'm actually just going to work out for this week, 2 days in a week, 2 days for this week. So I'll do 5 sets for my chest, that's 5 sets for my back on each day. So those will be 10 sets. And that will be a good starting point. Next week, I'll push it to 3 days of training. And maybe I'll do 4, 4, 4. So making it 12 sets. So I would have increased my sets in the week by 2. I may do 5, 5, 5 or 4, 4, 4. We shall see. So I've done 3 sets of the pull-ups, now 2 sets of rows. And that will make 5 sets in total for back. And for the push, I've done dips, 3 sets, and then I'll do 2 sets of push-ups. I may add a 3rd set for these rows and the push-ups. Let's see how that goes. Okay, so let's go. We are going for 15. 2, 1, let's go. I'm pulling to my hips. 5. That's 8. 4 to go. One more. Whew. So I like using this because it helps to anchor my torso, so that one, it's also protecting my back when I'm doing the rows, but then it's also making sure that I'm not using momentum, because when I go and I settle at the bottom of the movement, I have to pull with my back. Sometimes when you're doing bent over rows, when you're standing, you can keep using momentum as you come up, which is not the best for gains. Right, so push-ups. So I would want, by the end of these 6 weeks of training, I would want to be able to do 20 good form push-ups. So good form means I'm not just bouncing in and out of the motion, I'm going deep. That's why I'm using these dumbbells to ensure that I can go deep. So deficit push-ups, I can go deeper than I would if I was just on flat ground. I want to make sure I can, by the end of the 6 weeks, I can do 20 good form push-ups. Quick break, let's go. 15, 2, 1, let's go. That's 5. 5 to go. One more. All right. So, management of chronic kidney disease. 1, dialysis. Of course, if you're still at the, if you're in, the first step is, when it comes to management of chronic kidney disease, as I like saying, what's the cause? I want to ask, what exactly is causing this? Because sometimes, as I said, you may come in with chronic kidney disease or with reduced kidney function, but it's an acute cause. You understand? So you want to rule that out. And again, you can go to your doctor, preferably you go to a nephrologist, a kidney doctor. If there's no acute cause, and then you do your blood checks, blood sugar is borderline, or it's high. If your weight is high, like, don't wait for your blood sugar or blood pressure to go high. If your weight is high, and I repeat, and Timothy was going through the comments, I think on TikTok, and there's this video where I said, men, if your belly is not flat, there are problems happening. And there was a lot of hate going on in the comments. Yeah, and people were saying, what? You're telling people wrong information. What? No. Weight is, diabetes is genetic. At the end of the day, we are just trying to give you the information which you need. If you want to continue on the train of diabetes being genetic, be my guest, but against my best advice. I plead with the men, if that belly is not flat, please go and check, because I can't, if I had a penny for every man who came saying that, no, I'm fine, I don't have any issues, it's just the weight I'm dealing with, and his belly is protruding a little bit. If I had a penny for each of those who actually went and did tests and found a problem, I'd be very, very, very rich. Yeah, so find out what the cause is first. So if there's a weight issue, please get your weight in check. Get your weight in check. To be more exact, lose fat, build muscle. So focus on doing one, using exercise, doing strength training like what I'm doing. And again, if you want to go to the gym and use the machines, please go and do that. For me, it's more about applying the science. And I like the body weight training. I like the pull-ups. Like if you follow me, you will notice that, yeah, I do pull-ups, or we doing pull-ups for most of the workouts. Different variations, again, to challenge the back differently. But I just like the body weight movements, the dips, the pull-ups, yeah, and push-ups and all that. If you want to use machines, well and good. Just apply the science. Build muscle. Eat well. Eat enough food and eat the right food. Enough food will ensure that you're able to build muscle. The right food will also ensure that you're able to build muscle, but will help you control your blood sugar, your cholesterol, your pressure. You understand? So deal with the initial cause. And if it is the chronic kidney disease is again due to the two most important causes, type 2 diabetes and high blood pressure, of which what drives those is your weight, your belly. Please control those first. Now, while you're controlling those, because you're not going to control those in 2 weeks or in a month or in 2 months or in 3 months probably. It's going to be a journey which you're committing to. Now, while you're doing that, yes, go and see your kidney doctor. Why? Because, like, not all drugs are bad. There are some drugs which you can use to alleviate some of the symptoms. So if your vitamin D levels are low, get some vitamin D supplementation, some calcium supplementation you probably may need. There are some, if there is high blood pressure and you need to have a drug in the meantime, there are certain drugs which work better to control the blood pressure, but also while protecting your kidneys. So we call those ACE inhibitors, angiotensin converting enzyme inhibitors, or angiotensin receptor blockers. So generally, drugs which end with pril. So captopril, enalapril, and then for the angiotensin receptor blockers, ARBs, drugs which end with Saturn, losartan, candesartan, and so on. Like drugs which end with Saturn. Like those drugs protect the kidneys, but they're also helping you to take control of your blood pressure. They may also give you some, maybe like bicarbonate to manage the acid-base imbalances. So there's some drugs which they may give you to support. But I also know there are some clients who have sent to, like there's a gentleman who came in one time, elderly, had chronic kidney disease, diabetes, high blood pressure, weight. Unfortunately, he came in when his chronic kidney disease had progressed quite a bit. So we helped him drop his weight. He dropped his weight by about 13 kilos. We got his sugar in check, got his pressure in check. He actually went to his kidney doctor, and his kidney doctor actually got him off his drugs. Yeah, he got him off, like I think out of about 7 or 6 drugs, he remained with only one drug. Yeah, he's still alive. I don't think that he has gone yet for a kidney transplant, but he's actually still alive. But again, you see, those are some of the benefits which can come up by you actually addressing like the root cause. Fine, maybe he didn't address it as early as he would have, but guys, you never lose by trying to lose weight. You never lose. Even if you're at the end stage, it will improve your quality of life. Will it reverse it 100%? Maybe not. But it will improve your quality of life. It will buy you back a couple more days, weeks, or months, or even years with the people who you love. And maybe in that time, you could be getting money to go for, in this case, life-saving surgery. Yeah, because you've gotten the point where it's beyond. Yeah, so the end stage of chronic kidney disease, you're going to be really doing dialysis, where artificially there's a machine which helps to artificially remove the toxins and help balance your electrolytes, balance your acid-base levels. Yeah, so there's a dialysis machine which helps you do that. And there are different types of dialysis. I'm not going to get into that. I mean, you can go on Google and Google all those things. But dialysis is not fixing the problem. It's just trying to make up for the deficit which has been caused by you not having a kidney. You can survive with one kidney. So if you have 2 and for some reason only one is knocked out. In the case of chronic kidney disease, most likely both would be knocked out. But if you have one kidney being knocked out, it's most likely not because of diabetes or high blood pressure. It's most likely something else. Yeah, but you'd most likely you'd need to go to the next step of treatment, which is the kidney transplant. Like that's at least definitive. Of course, it comes with risks, like any surgery, bleeding, death. You can have the tissues not, you can have a reaction where like your body rejects the new kidney. But if that doesn't happen, you can basically get that kidney and go on to have a productive life. But still, you're going to have to come back and manage the root causes. So again, just like any of these surgeries, it's sorting out the issue. But again, if you don't deal with what led you there, you will mess up that kidney also if you continue doing the wrong things which led you there. And I think important to note is in the investigation, you could also do an ultrasound of your kidney. And sometimes you can actually we can actually see damage, like damage to the integrity of the kidney. So that can actually be picked up on the ultrasound. Next question, Timothy. I'll do push-ups first and then do the rows after. Well, Timothy gets another question. 2,
All right.
1, let's go.
So, seeing as we really need a number of tests we can do, check for kidney damage, seeing how crazy it can be. So, how often someone with type 2 diabetes check their kidney function?
3 reps to go. $15. How often should they test? So, I'll go first with somebody who's fine, or at least you think you're fine. You should be having, every adult should be having at least like 1 general checkup a year, especially if you begin hitting above 30. You should have 1 general checkup a year. Go and check your blood sugar, your pressure, kidneys, your cholesterol. Yeah, basic things at least. Liver function maybe. Yeah, basic things. Now, if you find a problem, then you want to make sure that you do a follow-up every 3 months until things get to normal. If things get to normal on 2 consecutive visits, they are normal, and you're instituting the right lifestyle, so the right food, the right exercise, you're taking control of your recovery, sleep, and so on, then in that context, results have been normal on 2 successive visits, you can now begin doing checkups every 6 months. Then I would say again, if they are normal on 2 successive visits every 6 months and you're still doing the right things, then you could take it back to once a year. But initially, whenever there are problems, you want to do it every 3 months. Actually, to be honest, for me with my clients, when it comes to the kidney function, if things are really low, like for the client whose kidney function was 40, whose EGFR was 40, we actually checked the EGFR if I remember well, every 6 weeks initially. Yeah, to make sure that we're not sleeping on anything. Understand? So go for rows. 15. Five to go. Two to go. Next up, we'll be doing bicep curls. We'll be adding an incline. Again, I like the incline because it helps to stretch the biceps. Whenever you can stretch a muscle, max stretch it as much as possible. Like in this case, the bicep is stretched. Before you start curling, you cause more muscle damage, which is what's needed to stimulate it to grow. Yeah, so yeah, you have to damage the muscle first for it to be stimulated to grow. As opposed to if you're doing bicep curls at this angle, like standing or while upright, the bicep is not under any tension. So we're going for 20 reps, 2 sets. So 40 reps in total. 2, 1, let's go. We may rest in between I like doing my bicep sets back to back. For me, it works better for me. Don't know what works better for you. It's 8. That's 10. 13, 14, 15, 16, 17, 18, 19, 20. So I'll rest just a bit. My biceps is not tired yet, so I'm not going to rest too much. I'm going to go to 40. So that's 2, 3, 17 to go. That's 8, 9, 10. Yeah, I'm beginning to feel the burn. 11, 12, 13, 14, 15, 16, 17, 18, 19. Yeah, so it hit me, I guess didn't really hit me all that much. I think when I'm doing them, the next workout, I'll up the weight. Yeah, I wasn't challenged much on that. So I didn't get that measurement right. All right, that's for next workout. It's week 1 of the workout. So again, you don't want to build up all your fatigue in week 1. It's okay to leave something in for upcoming weeks. Okay. Okay. So maybe with that knowledge in mind, I will lift a little bit heavier for the triceps exercise. I like putting this weight here just to balance the weight. That's something which I do. Again, I don't want to step on the bench with my shoes. Okay. So going for some kind of skull crusher extension thing. Again, I like crossing my legs just to protect my groins. I don't want to get a hernia. Sometimes I feel tension in that region when I'm doing this exercise. Again, I want to keep my back flat on the bench. I don't want that arch such that my hand can go under. I want to keep it all the way down, so that requires me to activate my abs. It's another thing which I like about this exercise. I challenge my abs also. 8, 9, 10. We're going for 20. 12, 13, 14, 15, 16, 17, 18, 19, 20. Rest a bit. So I'm going to cross over. And then even with my hands, left was over right, I'm going to put right over left. Again, I'm not going to rest too much, though this is challenging me more than the biceps one did. Let's go. If I need to rest in between there, I will. What we call a myo set. My reps rather. 5, 6, 7, 10. 7 to go. 4 to go. Triceps is burning. Let's push. 2 to go. That's it. Timothy, next question. Oh.
All right. Does weight loss and improved metabolic health reduce the risk of kidney disease?
Yes, absolutely. So weight is driving the process of insulin resistance, and especially weight, belly fat. So that's why, again, men and then women in their postmenopausal years are at higher risk. If your weight is not in check, get it in check. Get it in check. If your belly is not flat, get it flat. And that's where the nutrition comes in. Yes, so weight definitely plays a role. And unfortunately, it may be the only thing which shows up, which gives you an early warning sign, which if you don't pay attention to, if you ignore, you may wake up when it's too late. I already shared examples of people who didn't really have high blood sugar, like greatly, like uncontrolled blood pressure or blood sugar, but it was just the weight which was like shining that light, like flashing that red light in their face, sounding the alarm, but they were not taking note of it. And then only when they tested as a routine check, they found out that their kidneys were damaged to a considerable level. Yeah, so definitely lose weight, lose fat, build muscle, definitely. Very, very super important. Before you ask the next question, let me just go on to the legs. We will be doing something for posterior chain, so hamstrings, glutes. We are going to be doing Romanian deadlifts. So Romanian deadlifts. So I don't like normally going for higher reps for these. As I said, for me, legs is not one of the parts which is my weak point. So I don't, I kind of just do enough to get by. I have only enough fatigue to spread all over my body. I'd rather spread that fatigue to the upper body, which for me is a weak point. So I'll be going for 8 reps. And over the course of training, maybe push it to 12 reps. Okay, so 2, 1, slight bend at the knee, not too much. Take the weights down. Once I feel the stretch in my hamstrings, I come up. Slow down, keep the chest up, back, avoid the curve. Keep everything up nice and tight. Feel that stretch in the hamstrings, pull up. Quick up, slow down, feel that stretch, quick up. So women who are more flexible may not even bend the knees. Guys, do not be afraid to bend the knees just slightly. Once you feel a stretch, come up. Like for me, those are super effective. Just 8 of those, if I do 2 sets of that, like the next day, my hamstrings are dead. For like sometimes even for the next 2 days. So that's why, again, I don't do too much work with my hamstrings. Okay, I want to do some calf raises. So if I've done 8 reps, calf raises, I'll do 12. So again, bias the weight on one side, quick up, pulse down, quick up, slow down, quick up, control the down, pulse there a bit. That's 4. Six to go. Control it down. 4 to go. One more. I think I've actually done many. No problem. Let's go. 2. Actually, no. We'll do that on the next round. Okay, Timothy, quick question before I go for my next set.
All right, so seeing as losing weight and improved metabolic health will definitely help with kidney disease and kidney function.
Yeah.
Are there particular foods or dietary habits that can help reduce the risk of kidney damage?
Yes, again, start with first principles. What's causing the chronic kidney disease? It's the sugar, it's the pressure. Those are the most important causes of chronic kidney disease. What's causing that? Insulin resistance. What's causing that? Storing fat, particularly the visceral fat. What's causing that? elevated levels of insulin. What's causing your insulin levels to spike and be elevated? It's the wrong nutrition. What's the wrong nutrition? Too much carbohydrate, particularly refined carbohydrates. So sometimes I see people who have chronic kidney disease and they've come with a meal plan which is heavy on carbohydrates. And again, but people, please, your body doesn't know natural sugar and artificial sugar. It knows sugar. It knows glucose. It knows fructose. It doesn't know natural sugar, artificial sugar. So I see people coming with meal plans with fruits, juice, and all that. At the end of the day, guys, it's all sugar. The way you're going to start dropping your insulin levels is by focusing more on the healthy fat and protein. And again, from when I talk about protein, I'm talking about animal products. I'm talking about, and like meat. I'm talking about meat. I'm talking about chicken. I'm talking about meat, poultry, and fish. That's what I'm talking about. Like, and take your pick. You understand? Take your pick of the one which you're more comfortable with. And yeah, I mean, we have had people who have come with chronic kidney disease, and actually even some, like the gentleman I mentioned earlier, whose kidney function was actually quite very much reduced. And I mean, we just helped him optimize his protein, his healthy fat, reduced his carbohydrate, got out some of the junk which he was taking in. And that's how he was able to get the sugar in check, get the pressure in check. And even if he was at that point at which we could not reverse the condition, actually through the course of about 6 months of working with him, we were able to keep his kidney function, which was about, at that time, 16, at that level. It didn't drop any further. And he's still alive today. Hasn't yet gotten those other interventions which like the dialysis and the kidney transplant, which you would ideally need. Yeah. Now, am I saying that anyone who has that kidney function, just change your diet and avoid your doctor's advice of going for dialysis and kidney transplant? 100% no. Please go and see your kidney doctor. This is a choice which the gentleman took in coordination with his kidney doctor. He decided, no, I'm not going to go for that. I'm going to just live out my life in this situation which I'm in. That was informed consent. He took the decision. It was not forced on him by any one of us, either me or his nephrologist. Yes, so please do what you're doing, but in coordination with a nephrologist, preferably a nephrologist, not even just a general doctor like me. So like even me, a general doctor but working in this space, I'm going to send people to those specialists, and then we shall coordinate management. Yeah, don't try to do things on your own. Yeah, but the carbohydrate, we eat too much carbohydrate. It's the carbohydrate. Yeah. Next set, before you ask the last question, or next question, last set. Romanian deadlifts, let's go for 8, 2, 1, chest out, control it down, feel the stretch, come up. Feel the stretch, come up. Three. One. Okay. Cut phrases. So we started the last one with bias to the right leg. We'll start this time bias to the left. 2, 1. Sometimes I even lean on the left side to add more weight to that side. Slow on the down. Quick up. 8 to go. 6 to go. I've lost count, but I'll add 3. 2 and 1. Squeeze and come down. Good. All right, Timothy, next question.
All right, so for our last question. So, for those who do not know, or not be aware, this week, Thursday, 12th March, is World Kidney Day. So, as a doctor working in this space, helping so many people with these issues, if there's one message you want people living with type 2 diabetes to remember on this World Kidney Day about protecting their kidneys, what would it be?
Just a second. Let me think about that. What I'd want, I'll leave with a message of hope, because probably people in their minds, when they get a diagnosis of type 2 diabetes, particularly, worse still, if they get a diagnosis, if they enter the doctor's office and they were told that your kidney function is very much reduced, they feel like it's a death sentence. I would like to leave with a message of hope. One, type 2 diabetes is not a death sentence. I want to tell you that it's 100% in your ability to reverse type 2 diabetes. But that's only if you're willing to take the lifestyle changes which you need to do. Type 2 diabetes can be reversed. You do not need to be on medication. Follow the science. I could keep using that analogy. Gravity. If I drop this dumbbell, hope I don't mess it up. If I let go of it, it drops. Science, it's gravity which makes that happen. It's still the same thing. Type 2 diabetes can be reversed. It doesn't have to be a life sentence. You just need to adopt 3 things. 1, the nutrition. Start burning fat. Burning fat is going to help you reduce the levels of insulin resistance and hence control your blood sugar, your blood pressure. How do you do that? Eat to burn. Stop starving yourself. Stop the juicing. Stop the excessive fasting. Stop missing meals. Stop all these things. Stop trying to burn too many calories through things like lots of cardio and what, as if food is the enemy. No, food, the right food in the right amounts, the right quantity, the right type of food is medicine. So eat to burn. Stop starving to burn. Next step, lift to build. Lift to build muscle. Stop obsessing over exercise which gets you sweating. Look at me, I'm not sweating, but I've actually done a very effective workout. Stop obsessing over exercise which causes you to sweat a lot, to get your heart racing a lot. So lots of cardio, the Zumbas and the spin. Again, please, if your goal is camaraderie, some people like jogging, perfectly fine. Just let your goal be clear. If it's you want to break a sweat, you enjoy dancing, please, it's very fine. But let your goal be clear. But if your goal is you want to build muscle, start eating to burn, not starve to burn. The next thing is lift to build. Lift to build muscle. You've seen the kind of exercise I've been doing here, resistance exercise. The only way you're going to get your muscle to, the only way you're going to stimulate your muscle to grow is by putting it under tension. Now, cardio, Zumba, jogging, spin, going on marathons, going on the treadmill, swimming, is not really going to give you that stimulus. What's going to give you that stimulus is putting that muscle under tension. So you have to be lifting weight of some sort. It could be free weights like these dumbbells. It could be body weight like the push-ups and the pull-ups I was doing. It could be machines like fixed weights, like some of those machines in the gym can help you do that. There has to be some resistance. Again, if your goal is leisure, if you like the camaraderie of hiking or of going on a jog with friends, please, that's very okay. But just be clear of your goals. Unfortunately, we cannot attain, we rarely can attain all goals doing exercise. You kind of have to pick 1 or 2. And many times it's 1. Now, I'm fortunate that I actually enjoy doing the pull-ups and what. So I'm getting the goal of the metabolic health, building muscle and so on, while also actually enjoying what I'm doing. For some people who really like the cardio, you're going to have to strip that back. sometimes significantly, depending on how much you've been doing. It could be the one thing which is making you lose muscle and hence fail to control your blood sugar and hence make you gain weight like on the long term. So lift to build muscle. That's the only way you're going to do it. If you try to focus on things which make you sweat, doing the cardio and what, you'll just be going down the wrong lane of things. And then the last thing is rest to boost. Rest to boost recovery. So 3 B's: burn fat, build muscle, boost recovery. Recovery is very important. Sleep is the most important thing under recovery. When you sleep, you lose most of your fat. Remember, fat is what is driving the process of insulin resistance. So you need to boost your recovery. You need to be sleeping. You need to be aiming to sleep for 7.5 hours, even 8 hours if you can. The best athletes actually sleep, some of them even for 9, 10 hours. Again, you may not be able to do that, but do the best you can. Do the best you can. And there are things which you need to do to make sure that you're able to have quality sleep. Some of these things you need to start doing them as early as the later part of your afternoon to ensure that by the time you get to bed, your hormones, cortisol, melatonin, all those are in the right ranges, even insulin are in the right ranges to ensure that you actually have deep sleep. So type 2 diabetes can be reversed. And by you reversing type 2 diabetes, taking back control of your blood sugar, of your blood pressure, then also the kidney damage, if it's not gone that far yet, you can actually reverse the kidney damage or improve your kidney damage significantly to the point that you can still have a good quality of life and still live longer. Again, it's two sides of the coin. One side of the coin is that there is hope. Type 2 diabetes can be reversed. Your blood pressure can actually, the high blood pressure can also be reversed. The kidney damage can actually be reversed depending on how bad it is to a certain level. But again, the other side of the coin is if you come too late, then even if you could potentially be able to take your sugar under control, your pressure, lose the weight, the kidneys have been damaged. Still, even with that, there is still hope. You can still get a kidney transplant. It may be harder, but there's still hope. That's what I want to live with. Type 2 diabetes, high blood pressure can be reversed. Please, you do not need to be on medication for the rest of your life. Just adopt the right lifestyle. Tackle the root cause. Tackle the root cause. Tackle the root problem. Cut the tree at the root. Don't pull off branches. Don't prune by relying solely on medication. Yeah, deal with your lifestyle. That's the message of hope. Thanks for watching this episode of the Between the Sets Exercise podcast. If you found value in this video, then like the video and subscribe by clicking the icon somewhere about here to make sure that you never miss any episode that we release. The Between the Sets Exercise podcast goes live every Wednesday, 3 p.m. East African time. If you missed last week's episode, then click here. Or if you want to watch another video by us, then click here. Speak soon.